Hi, I'm Katie Ayers with the Medicine Hat SPCA, and welcome to Critter Care. In today's segment, we're going to be talking to Dr. Andrea Storch over at the Cypress View Veterinary Clinic, and we're going to be talking about some signs and symptoms and when you should be accessing veterinary care. So she's going to be talking to us about choking, what are some of the common items that our pets will choke on and what we can do. She'll also be talking about reactions to things like poisons and other toxins and how we should be dealing with that as pet owners. Finally, we will be also referring to, with our really hot weather here in Medicine Hat, why it is important not to leave your dogs in hot vehicles. So stay tuned, we'll be right back. So we're here with Dr. Storch at the Cypress View Veterinary Clinic. We're going to be talking about a couple of topics that we get a lot of questions about, or we'll see questions about online. So the first one is choking and different things that your animals might be choking on and then what to do. And the second topic we're going to talk about is if they have a reaction to something. So whether it's a wasp sting or some type of food that they eat. So Dr. Storch, thank you so much for meeting with us today. And I know for myself, having had a number of pets over the years and working at the shelter, I've had animals that have choked in my presence. And for sure I get really anxious and I'm not really sure kind of what to do to help them. There's varying degrees of emergency when it comes to choking. Can you talk to us a little bit about, what is most commonly the case, what they choke on, whether it's a cat or a dog, and what, your initial kind of reaction could or should be if we're thinking clearly?
Right, for sure. It's very scary when you have something like that happen. And so the first thing to do is take a breath. You're going to want to calm yourself down because you do have to think clearly in these situations. What you're going to notice is it's going to be associated with something they were just doing, right? So they're probably chewing on a bone or a rawhide or a toy, and those are the most common things. Food is also a part of that. So in that realm of things, they can choke. So there's different types of choking. At this point, when you notice it, you're not going to know which one it was. And the biggest thing you want to do is look in your pet's mouth, reach in and grab whatever is causing the choke. If it's a cat, which it can occur in, it's not as common for them to choke, using your pinky finger or a smaller finger to kind of reach in there and scoop out whatever might be choking them is the key in that instance.
Okay.
You should probably have someone on the phone with the veterinarian right away. A lot of veterinary clinics have emergency lines associated for emergencies. So at any time, something like this, we would consider something that you would want to call us about, and we can guide you, especially in that first stage of panic.
Because it can become a breathing emergency, of course, and really will require veterinary attention. And if you have multiple people with you, it's nice to be able to have one person driving to the clinic, one person on the phone with the vet, and then the other person in the back with the animal trying to comfort them, especially if you weren't able to reach the object, or trying to kind of get the object out as much as possible with your fingers.
Absolutely. And when it comes to them choking, when I said about the two types, so there's two ways it could go. The one is into the airway and the other is into where they eat and goes into the stomach. And most commonly we see the one in the esophagus, which leads to the stomach. However, the other one can be a little bit more critical and can really affect their breathing. And so that would be why it would be important for you to be a pet owner and understand different techniques, like taking a first aid course to kind of know what you can do at home so that you can prepare yourself on coming to the clinic. in the event of a choking animal, and if they're still choking when they come in and it's in the esophagus, there are separate things that we can do. We take it very seriously. And so that would be discussed with you, with whomever your veterinarian is.
And not all choking, from what I understand, is necessarily, like, it's always an emergency, especially if you can't get it out. But there's times where there's an object lodged, but there's still air able to pass, potentially. So sometimes would you have to remove the object surgically?
Most of the time, it depends on what your veterinarian has for equipment.
Okay.
It may require surgical removal. And if it does require true surgical removal, that is something that tends to be done by a specialist.
Okay.
If it is something that we could if it's in the esophagus, we can sometimes push it back into the stomach or remove it right from there. That, again, depends on the equipment that the veterinarian has, but regardless, they tend to have to go under a general anesthetic for something like that. So things that you're going to notice if they are choking is going to be breathing difficulties. And if they still have the ability to breathe, sometimes they're gulping quite a bit, and that might require for your veterinarian to go in with a scope of some kind to look in the esophagus. So.
Okay. What does a breathing, you mentioned breathing difficulties, but what does an animal experiencing breathing difficulties look like? Are they gasping for air? You mentioned gulping. Would they potentially lose consciousness? What might be a sign that your animal is choking if perhaps you weren't present and saw them swallow some item?
Right, great question. So the biggest thing you're going to notice is if it's a complete obstruction of some kind, they're going to struggle to breathe. You're probably going to not hear anything. And the biggest thing you're going to look for is bluing of the mouth.
Okay.
That's telling you they're not getting any air.
Okay.
So that's quite important. And even with some of our pets that are maybe have shorter noses, they're going to have more of those difficulties anyways. So something like this is a little more serious for them. Okay. You might hear them whining or gasping in some way. They're going to be distressed, so they're going to come to you in a panic. Mm-hmm. They're not going to just hang out there.
Yeah. And let it happen.
Just let it happen, right? So they'll come seek you if you're not there, but otherwise the next step would be loss of consciousness because they're just not getting oxygen. Yeah.
I was telling you a story about one of my foster dogs. It was a Chihuahua, and she had swallowed a bone, and it was half chewed and half unchewed, and I was really surprised at the amount that she could swallow being such a small dog. Luckily, in her case, when I opened her mouth, I could still see part of the bone, so I reached in and I pulled it out. And I remember thinking, I didn't realize it was going to be so long, and I pulled it out rather quickly. And I did go and follow up with the vet because I was worried about, did I injure her esophagus? Would you always recommend that the owner follow up with the vet, even if you are able to remove the item yourself? Mm-hmm. Is that something that could injure the animal's esophagus or trachea? I'm not sure.
Yeah, anything that goes in that is rough or gets lodged in some kind is going to cause some trauma. Mm-hmm. And it's advised that you do have a follow-up. But depending on who your veterinarian is, they may prescribe you something to soothe the throat.
Inflammation, perhaps.
The inflammation, or coat the throat to make it more tolerable. Okay. If your pet seems fine, then unlikely that they're going to have too much trauma. But it depends on what it is. Your example, it was big bone. You want to get that checked out. If it's something like a little soft piece of food, it's unlikely that it was going to cause too much trauma. So it's really on what it was and how they're acting afterwards.
So the next thing we want to talk about is reactions, because our pets are very inquisitive. Cats and dogs like to sometimes eat things they're not supposed to. They'll sniff things, they'll touch things that maybe they shouldn't have got into, and they can have adverse reactions. Can you tell us a little bit about what are the most common, reactions that you've seen? And I know they vary a fair bit, but I'm thinking it's usually something that's perhaps a poisoning, or they've eaten something that's caused a reaction. What does that look like when they come into the clinic?
Yeah, so like you said, pets are just what they are, and they like to go in and sniff and feel and experience everything that they can experience. So they can have allergic reactions or adverse reactions to these things. The biggest things we can see in our pet is the swelling of the face. That's pretty common. Or even they can get a bit of hives, which is something that people get. So bumps throughout their body, like they're having a reaction of some kind.
Okay.
So it doesn't really matter if it's something that maybe bit them. That might be more localized into one area, or something they consumed. So if those things occur, then it's best to give your veterinarian a call and they can guide you through. A lot of them are something that are able to be managed at home, but there's quite a few that should probably come in and get seen. So the biggest things you want to know as a veterinarian about a pet having a reaction is what the progression is. So if you notice, let's say the muzzle starting to get swollen on one side and now it's progressing to the other side, something you should probably bring them in for the veterinarian to give them an injection of some kind to help slow down that process. The biggest thing that you're going to want to be prepared for is any breathing difficulties. Right. If you notice that your pet is starting to have a little bit more labored breathing, or they are acting more lethargic afterwards, then that's when the red flag should go off in your head and you should call and bring your pet in, because that could indicate that they are going to go into a full anaphylactic shock. Okay. Not very commonly do we see it, but it could happen, because it's like with people, you don't really know you're allergic to bees until you have an anaphylactic shock, right? So it could be something that they've experienced a lot and it could cause it. So the unfortunate part is I can't say exactly every single item that could cause a reaction.
It could be almost anything.
It could be anything. And a lot of the times we just don't know what it was to begin with. But those are the things you're going to be looking for.
Okay, and you did mention poisons as well, and I know, unfortunately, we do see cases of poisoning, both accidental and on purpose. What are some signs that might be a bit different when it comes to an animal being poisoned?
Right. So it depends on what the poison is. A poison to a dog and a cat are much different sometimes to what they are to us. So the big ones, like true poisons, like anything mouse-related poison, rat poison, those types of things, the biggest thing people notice and when they bring them in is that they've seen them or found that they have consumed or that stuff is missing. And that's the biggest key, and they should be brought in immediately on to the care of a veterinarian, and they will guide you through what the next steps are.
Are they commonly vomiting with those ones?
They don't start vomiting until later, right? So they can a lot of the effects that they can have are going to be later down the road. So that's being said, it's very important if your pet is acting strange or is not doing well that you bring them to the veterinarian anyways. And usually the veterinarian will talk to you, have they gotten into anything? Did they eat anything, or are you sure? Did you have any of this out? Some things that could actually also lead to toxic effect is stuff like mushrooms in the backyard. We've seen some of those where they come in neurological, or meaning that they're shaking. Stuff like molds can also lead to it. But those are things that we commonly think of as potential toxins, but other things we don't think about are onions and grapes and different types of nuts, like a particular macadamia nuts. Those types of things can lead to some sort of effect, and they all range in different things. So usually the big common signs we tend to see with anything that is maybe irritating the stomach would be vomiting. But otherwise, they all have different types of effects, which means that it's very important to supervise your pets. And if you notice something wrong, go investigate and see, did they maybe get into something, and then call your veterinarian.
Often little bits of it left behind.
Yeah.
And I hear that really the most common things that pets tend to have a reaction to when it comes to a poison or something that's poisoned them is a human food or a human medication. And I guess it kind of makes sense because they're often around the house. So especially if you have the type of breed of dog, and I always think of labs because they like to eat everything. Like what animal eats a bottle of Tylenol? If any animal, it will be a lab because they don't taste that good, but they're more likely to, they can be a bit mischievous and get into some things,
for
but
sure.
just, you know, if it's their personality in general, you want to make sure that you are pet proofing your house and putting, of course, all of your cleaning supplies and medications away, but knowing which foods are toxic. And I imagine it has something to do with the quantity of the food that they do consume, as well as their own physical weight and size. But there's also probably anomalies where a large dog could eat a smaller piece of chocolate and have a reaction to it. So there's so many variables.
Yeah, absolutely. And for example, a good one would be a grape or a raisin.
Right.
We don't know which animal is going to react to it, but all they have to have is one grape or one raisin. If they're the dog that is going to have the reaction, they'll have a reaction to that. So we have to be cognizant of that and be honest with your veterinarian, because there's also, you know, you talked about medicinal things. Stuff like vitamins also can lead to a lot of problems, but non-medicinal or recreational use of things, you have to tell your veterinarian so we know how to properly treat your pet. But it's a wide variety of symptoms you can see, but most of the toxic, caustic things that irritate the tummy will lead to vomiting. But I guess
or diarrhea.
And
sometimes seizures,
absolutely.
even if it gets more advanced.
Yeah, exactly. So the biggest thing, I guess the key from here is just kind of know what you have in your yard, know what you have in your house, and just know that you're supervising them. Even going back to choking, you're supervising your pet when they're chewing on rawhides, you're supervising them when they're playing with toys. That's going to help you quite a bit, because we're going to be able to treat them quicker.
Absolutely. Thank you very much. Thank you
You're
for your
welcome.
time.
Absolutely.
I'm here with Mac right now. You may have seen Mac on social media or on our website. He came into us after having not the best diet for most of his life, and he was morbidly obese. He had been eating ravioli, is what we hear. So when Mac came to us, it was pretty obvious, based on his size, that that was certainly a symptom of something else going on. It wasn't just his food consumption, of course. He was so large that it was a sign that there was perhaps another issue. He also had, in combination with his size, he had some hair loss, so around his tail and around his neck. So both of these signs together were telling us that perhaps he needed to have some blood work done. So when his blood work was done, it did come back showing that he had hypothyroidism, which is a really not uncommon and not difficult to treat illness, but it does have a number of consequences when left untreated, like with Mac's case. So he is literally right now half the size he was. He's lost 20 pounds. And for a Jack Russell Terrier, that's quite a lot of weight loss. So that's since partially going on the hypothyroid pills, the thyroid tabs, as well as changing his diet, of course, and no longer feeding him ravioli, because that's not a proper dog food. So Mac is just an example of, there's a lot of different signs and symptoms that you want to pay attention to and know your animals and know what they're like normally, so that if something changes, whether it's how often they're eating, how often they're urinating, the consistency of their feces, whether it's the change, maybe their breath smells different, and change in their energy levels. You want to pay attention to all of those signs and symptoms, because they can tell you, especially if they're in combination, if there's multiple signs and symptoms, that you need to bring your animal in to see the vet. There might be something going on that requires blood work or urine work or some other type of diagnostic tool, but we aren't vets, we aren't able to diagnose. Dr. Google will not tell us exactly what is going on. You usually have to have something done in terms of blood work or something to figure out in that case. So pay attention to your animals, know what's normal for them, And if they are experiencing something that's unusual, then be sure to consult with your vet and find out what's going on. So with the summer comes, of course, some pretty hot weather here in Medicine Hat. And we hear a lot about this in social media, I know, but we also want to reiterate the importance of not leaving your dogs in hot vehicles. And there's a number of reasons for this. Of course, they can overheat really quickly. Even when you have the windows down, the still air can easily go 10 degrees over. And when it's already, 20 to 35 degrees here in the summertime, then we're talking some pretty hot temperatures inside of the vehicles. Some people will say, oh, but I put the air conditioning on and then I went and did my food shopping, so the dog's okay. The worry with this, and it certainly has happened, is that what if something happened and your air conditioning failed and you were gone for a longer period of time, and the animal would have then been in a vehicle also with the windows down and perhaps no air conditioning as well. So that's a bit of the worry with counting on an air-conditioned vehicle. So ideally you would just leave them at home, or if there's someone else in the vehicle that can wait with the pet while you're running inside for something, then that's a good way to handle it as well, because they can monitor and make sure that the animal isn't overheated and has access to water and everything that they might need. Animals can absolutely suffer from heat stroke if they are outside for too long in the sun. So we want to make sure that if they're in your yards as well, that they have access to shade and access to fresh water. And ideally that they're not out there for prolonged periods of time in an area, especially where they can't get access to too much shade. If an animal is overheated, they'll become really lethargic. They will have a temperature usually because their body temperature raises. And it's really important to get that temperature down if they do have a fever, and it can eventually lead to having seizures and some other more serious consequences as well. So just remember to consider your pets with all of the heat that we have. Be sure not to leave them in the car unattended, and ideally leave them at home if you're having to go out and do some shopping. The other thing I wanted to mention quickly is we get a lot of questions about walking our dogs in the heat. So at what temperature is it too hot to walk your dogs? I don't know about you, but I have one of my 3 dogs anyways. She will not let me go a day, whether it's plus 30 or minus 30, without a walk. So I have to use my judgment, and I have to dress her properly. So in the heat, I can do things like put booties on to protect the pads of her paws, make the walks really short. So we usually do no more than 10 minutes if it's over about 27 degrees in our case. And of course, having access to water, so bringing one of those portable dog water dishes can be handy as well. You want to test the ground with your foot and make sure that it's not too hot. If it's too hot for you to walk on, it's too hot for them to walk on. There are some protectors that you can get, like I was talking about with the booties. You can also get a pad protector. It's like a cream, almost like a wax, that will help as well if you do have one of those dogs like mine that's going to insist on going for a walk even in the warmer weather. So you need to use your judgment and make sure that you are considering their needs as well, and taking care of their paws in the hot weather is super important. Otherwise you could be dealing with some blisters, some burns, or even some of the pad peeling off. So for anyone who's been to the SPCA, you will have noticed that we really need some renovations. We have been in this building since 1994, but the building itself is about 35 years old and was never meant to be an animal shelter. It was originally a warehouse, and we did have it outfitted in 1994 to try and build us a decent space. But at this point, due to 23 or so years of over 10,000 animals being in the facility, it is quite run down. We have many areas needing repair. We also have just some areas that need a bit of a redesign to work with our flow now that we're no longer pound services, but just to better facilitate kind of the needs that we have today. And we need, of course, new flooring, new paint, and all of this. You can see in this space, we have tile floor, which is not, and this is our isolation room. So for anyone that knows anything about disease management, this is some of the worst flooring you can have for disease management, because in isolation, we usually have animals that need to be more protected from disease, and tile floor, the grout is very porous. So we really need new flooring, new paint, new kennel space. We have major issues with storage, and we also really want to be able to add on, in addition to the building, to be able to provide more humane education programming. We don't currently have a space where we can entertain any groups of people and provide seminars or training, our pet first aid classes, or even just meet with the kids that come in from school on different tours. So we want to add an addition onto the building as well, so that we can provide some more educational programming. So those are some of our needs, and this campaign will be on our website. You can visit www.medhatspca.ca to read all about it. And there's a number of different naming opportunities and ways that you can pledge a financial commitment to helping us renovate our shelter. Our goal amount is $700,000 in order to renovate our entire shelter and to add on the addition.